I'm Joe Wynn with the National Association for Black Veterans. I'm the legislative liaison for our national organization, also the president of the VETS Group, the Veterans Enterprise Training and Services Group. Our NABV VETS Group is headquartered in Milwaukee, Wisconsin. We've been servicing veterans for well over 40 years now, and the VETS Group is actually located right here in Washington, D.C. at 1200 18th Street Northwest.
Great. So we're here, and it's our second annual Time Out for Veterans Health event. Last year we had 700 veterans and their families participate. What do you think, as you look around today, what's your feeling about the importance of today's event?
Well, it's very important. It looks like you had a great turnout again this year. I think it's helpful to promote it throughout the community because we're able to get so many veterans who are probably not having an opportunity to get a health screening. They can at least count on coming out here once a year to FedEx Field and get a full health screening. This is great.
So let's talk a little bit about that partnership, because it's the 12 other veteran service organizations, 11 other veteran service organizations, the Redskins, GSK, the health partners. What do you think about everyone coming together to better serve you all as veterans?
Well, without a doubt. I mean, the more organizations you can get together, the more word you can get out to the community, the greater the impact. Hopefully we can also work together on other initiatives as well. One of the things that seems to be lacking throughout the whole Veterans Administration is the outreach, getting the word out to the veterans. Oftentimes there's a lot of good programs available for veterans, but if they don't get the information, they can't benefit from it. So by us coming together, working together, communicating, sharing, and exchanging information, more veterans are going to benefit.
Right. So let's talk a little bit about prevention and early detection. We're here offering all the different health screenings. We added HIV and ocular exams today.
Right.
Can you talk about the importance of hitting each of these different stops in the health screenings today?
Well, I think, again, having even the additional ones on there, especially the HIV, is very helpful, and in particular in this area. Unfortunately, this area has a higher incidence rate of HIV, so to have the opportunity to come out, freely get tested, could benefit a lot of people throughout the community. I think, too, the way you had a station set up is very easy to access each station. That's a good thing. It'd be tremendous opportunity to do this even more. That would be great. So looking forward to doing it again whenever the possibility arises.
So I know we talk a lot about prevention and early detection. Are those things that you spend a lot of time talking to your members about, is getting in there early?
Especially on the prostate cancer. As you know, particularly, I work with a lot of African Americans and the veterans who are in this community. A lot of them are African Americans. And prostate cancer is one that we are definitely trying to get them to go for testing early and often. That's kind of the motto now, early and often, so that they can try to get up front, get ahead of that possibility of that disease. If you can detect it early, it sounds like the chances of getting rid of it are a lot better. So that's what we want to do.
That's great. Yeah. We talk about the Washington Redskins. We talk about GlaxoSmithKline. Is there something, take-home message you would like to give to them today about making this event possible?
Yeah, well, I'd like to see it more often. As I mentioned a moment ago, GlaxoSmithKline has been supportive of our veterans initiatives throughout the year, not only this year, but the last couple of years. They're doing some nice things here in the community, and I'm sure they're doing some things in other communities around the country. They are also members, as you know, of our Veterans Health Council, and we're able to exchange information and ideas not only with the veteran service organizations, but with the other mental and medical organizations throughout the country. So this has been a tremendous help. I'm glad to see that they are, behind this 100% and working with us and veterans and the other organizations. So looking forward to doing it and doing it more often.
Well, great.
Yeah.
Well, we can't thank you enough for your partnership and your service.
Oh, thank you.